Hello, thank you for tuning in to our video on Telehealth Made Simple, the do's and don'ts. My name is Mike Watula, and my role with TMC is to support our customers and operations team with census tools and resources that promote successful referral partnerships. My background encompasses 26 years of service in the geriatric industry, and I am passionate about identifying alternative approaches to our healthcare environment and to explore avenues to help better serve our customers to maximize their census. My objective today is to provide an overview of how Medicare defines and outlines their parameters for telehealth and virtual services. Just a disclaimer before we start. Updates are coming in daily from CMS, and anyone providing these services should do their due diligence with research and CMS updates. At the end of this video, we have provided some links to access for more in-depth research and clarification. Our industry is adjusting to the way we provide care in response to the COVID-19 public health emergency. Telemedicine, telehealth services, and multiple platforms have had significant attention and growth over the past year. The pandemic has directed additional attention to telehealth and new technology to better serve our patients. There are three main types of virtual services physicians and other professionals can provide to Medicare beneficiaries. The first one is Medicare telehealth visits. The second is virtual check-ins. And the third are e-visits. First, let's discuss Medicare telehealth visits. CMS says telehealth, telemedicine, and related terms generally refer to the exchange of medical information from one site to another through electronic communication to improve a patient's health. CMS is expanding this benefit on a temporary and emergency basis under the 1135 Waiver Authority and Coronavirus Preparedness and Response Supplemental Appropriations Act. Under this new waiver, Medicare can pay for office, hospital, and other visits furnished via telehealth across the country and including in patients' places of residence starting on March 6, 2020. Medicare will make payment for Medicare telehealth services furnished to beneficiaries in any healthcare facility and in their home. These visits are considered the same as in-person visits and are paid at the same rate as regular in-person visits. So the 1135 waiver requires an established relationship. However, HHS will not conduct audits to ensure that such a prior relationship existed for claims submitted during the public health emergency. The provider must use an interactive audio and visual telecommunication system that permits real-time communication between the physician's location and the patient at home. The practitioners who can conduct and get payment for covered telehealth service are subject to state law, but can include physicians, nurse practitioners, physician assistants, clinical social workers, and registered dietitians. However, the full list of providers can be found in the telemedicine healthcare provider fact sheet. Physical, occupational, and speech therapists are not included in this list, but 21 speech, occupational, and physical therapy CPT codes were added to the list for the public health emergency. So therapists cannot currently bill for telehealth under their national provider identifier issued by CMS, which is also known as their MPI number. Popular workaround getting attention that I want to clarify is not considered telehealth by CMS. In an article from Skilled Nursing News titled CMS Considering Expansion of Telehealth for Physical, Occupational Speech Therapy Services, Emily Yoder, an analyst with CMS Division of Practitioner Services, said, "We're currently thinking broadly and expansively about telehealth." She did provide an example of a kind of telehealth workaround that therapy teams can currently use in nursing homes during the COVID-19 crisis. As long as both the patient and the provider are in the same building, therapists can bill for services conducted over audio-visual devices as though they were performed face-to-face. As I said, this has received a lot of attention, and comments from the APTA and ASHA have followed. The APTA said, The question raised on the CMS Open Door Forum was specifically regarding how a PT or OT can complete a supervisory visit requirement for Part B, which would be the 10th visit requirement, as well as provide treatments and/or evaluations while directing the PTA or occupational therapist assistant. The answer from CMS was that this is possible, but would be billed as if it were furnished in person, not a telehealth visit. ASHA said this new flexibility is not considered an expansion of telehealth coverage or eligibility by CMS. However, this flexibility does provide SNFs and SLPs an important opportunity to continue providing medically necessary skilled services to those patients who require them while reducing the risk of disease transmission during the COVID-19 pandemic. ASHA encourages SLPs and SNFs to use this virtual mode of service delivery when deemed clinically appropriate and not exclusively for the convenience of the SNF or the clinician. Next, let's discuss virtual check-ins. They are intended for established Medicare patients. Patients may have a brief communication service with practitioners via a number of communication technology modalities. Included are live two-way audio-visual communication or exchange of information through video or image while in their home. Medicare pays for these virtual check-ins for patients to communicate with their doctors and avoid unnecessary trips to the doctor's office. Here are the two HCPCS codes with their description that a physician or a practitioner would use. The Medicare coinsurance and deductible would generally apply to these services. Now let's discuss e-visits. E-visits are allowable in all types of locations, including the patient's home and in all areas, not just rural, where established Medicare patients may have non-face-to-face patient-initiated communications with their doctors without going to the doctor's office by using these online patient portals. The patient must generate the initial inquiry, and communications can occur over a 7-day period, and the patient must verbally consent to receive virtual check-in services. The Medicare coinsurance and deductible would also apply to these services. Medicare Part B pays for e-visits or patient-initiated online evaluation and management conducted via a patient portal. Practitioners who may independently bill Medicare for evaluation and management visits, for example, physicians and nurse practitioners, can bill these following codes. Which code to use is based on the cumulative time provided during a 7-day period. Clinicians who may not independently bill for evaluation and management visits, for example, physical therapists, occupational therapists, speech language pathologists, and clinical psychologists, can also provide these e-visits and bill the following codes. The Medicare coinsurance and deductible would also apply to these services. Here's a summary of telehealth visits, virtual check-ins, and e-visits from CMS. I want to share a very common question that's being asked. What is the difference between an e-visit and a telehealth visit? CMS states an e-visit is a service that would normally not occur in person and are not paid as though the service occurred in person. A telehealth visit is a service that would normally occur in person but are instead conducted via telecommunications technology and are paid at the full in-person rate. Providers would bill their normal CPT codes per the insurance carrier's policy that they would bill as if the patient had attended an in-person visit. Just to clarify, telehealth services are clearly distinguished from virtual check-ins and e-visits. I encourage you all to access any of these resources for additional clarification and research. The first one are the HIPAA guidelines for COVID-19, and please always remember to research your local state regulations. The second one is the telemedicine fact sheet, and the third one are your telehealth codes. If you do have any questions, please reach out to us at TMC Business Development at therapymgmt.com. Thank you for watching our video on the telehealth made simple, the do's and don'ts, and we hope to have provided you with some helpful information. Our monthly education webinars will continue next month, and we look forward to hearing from you. In the meantime, our thoughts and prayers are with you as we continue to face the challenges of COVID-19. Thank you again. Stay safe and stay healthy.